All right, welcome everybody to our webinar today. This is Osmind's 5 questions to ask when selecting a psychiatry EHR. I am so excited to be here today talking about my favorite subject, which is EHRs. My name is Dr. Carleen McMillan. I'm the VP of Clinical Innovation here at Osmind, and I am a practicing psychiatrist and basically have been at Osmind for a little over a year working on the product. I really came to Osmind because I've had a sort of decade-long quest to find EHRs that worked for our workflows as psychiatrists. And really, there's a lot out there. They all have pros and cons. And I basically was fielding questions all the time on various forums from various colleagues about how to choose one, what should we look for. There's some really common themes. And so today we are very fortunate to have Reese Becker here, who will be going through this whole landscape. He is one of our account executives here at Osmind and has basically like this really unique bird's eye view talking to many psychiatrists across the country about what their pain points are, what their priorities are. And so while we won't be focusing today on you should choose this EHR, not this one or that, it's really more to think about what questions do you have, what matters to you, what's kind of a no-go for you with an EHR, and what's really going to kind of move the needle towards deciding on one. So with that, I will turn it over to Reese. If you have any questions at all, please feel free to put them in the chat or submit them, and we will get to them most likely at the end, unless there's something that needs immediate clarification. Actually, before we begin, just quickly about Osmind, we are an EHR. We are more than that as well. We support practices who are getting started up. We have a lot of great content around that. And we're really interested about the future of mental health, where psychiatry is going, where the field is going, and making sure that you have the technology and infrastructure to be ready for that. So with that, I will turn it over to you, Reese.
Awesome. Thank you, Carleen, for the wonderful introduction. Hey, everyone, my name is Reese. As Carleen mentioned, I am one of the account executives here at Osmind. So I have the opportunity to speak with a lot of clinicians like yourselves every day to really understand and help them on their EHR buying journey to understand their current experiences with EHRs and maybe their current frustrations, what they really enjoy, and to help them find that best fit for their practice that really suits their needs. So the point of today's conversation is it can be really hard to find that right EHR for your practice. So I want to be able to share some really key questions I recommend asking the person that you're speaking with at for each vendor to ensure that you're making the best selection for your practice. Wonderful. Yeah, and so for today's agenda, where I thought it was really important to start is we can just do an overview of the psychiatry EHR space, and then we'll go into identifying your needs to find that perfect fit EHR for your practice, and then third, kind of why we're here today, is we can jump into those 5 questions that I think are really important to ask to set yourself up for success, and then we'll run into a quick Q&A to ensure we can help answer all of your questions. Wonderful. So breaking down the EHR space today. So when you begin the journey to find the right fit EHR, you might go into Google, type in EHR private practice, and if you do so, you're going to find a lot of results. There's a lot of EHRs in the market, and especially if you're coming from a larger hospital system where you're using an EHR like Epic or Cerner, the EHR specific to private practices are very different. So it can be difficult to understand to kind of where to start or to where to tailor your search. So how we've kind of broken this down is into 3 different buckets. We have your therapy EHRs, your more general EHRs, and then your mental health EHRs. So your therapy EHRs, these are going to be more for psychotherapists, and while a lot of clinicians or, clinicians who I speak with who might be using this today, they really like the note templates. They might be easy to use, but they're maybe missing some key features like an e-prescribing integration, which are really critical to your role, or a labs integration, things that you might not think about. So just keep in mind as you do come across therapy EHRs like this, that they might not have those integrations available. Second is general EHRs. So these are EHRs tailored to private practices, no matter your field of practice. So while a lot of clinicians, a lot of psychiatrists use these today, they won't be tailored to psychiatry. And because of that, they might be a bit overcrowded with tools or templates or functionalities that might not be relevant to your private practice today. Just something to keep in mind as well as you're navigating those types of EHRs. And then lastly, you'll have your mental health EHRs. And these specific EHRs, like Osmind, were created and built with psychiatrists and behavioral health in mind, and thinking about, okay, how can we really make their day-to-day really simple? How can we elevate the patient experience? So this is a great place to begin your EHR search to see if you can find that perfect fit there. And they're going to really focus on things like bringing in or tailoring intake to psychiatry, or bringing in that intake into that first evaluation session, or automating the delivery of measurement-based care with PHQ-9s and GAD-7. So as a recommendation, I think the mental health EHR space is a great place for you to begin your EHR search.
Yeah, and Reese, I can just add a little bit to this. So like in my practice career in both individual and group practices, I've used kind of every category of this. And I will say, like with the therapy EHR, if you have therapists in your practice, they tend to really like this, but then the psychiatrists and psych NPs in your practice find it wanting. And similarly, with the more medical EHRs, the psychiatrists may be, okay enough. There's features they like, they're using e-prescribing. But if you have therapists, or if you're a psychiatrist who does a lot of therapy yourself, there's really nothing there for you for that purpose. So I think we could almost make this, if we had a Venn diagram, the mental health EHRs that are designed specifically to accommodate psychiatrists basically kind of have, I think of them as having the best of both worlds, in terms of being enough medical to do what we need to do, but enough therapy to also kind of capture those elements of a visit.
Wonderful. Thank you, Carlene. Awesome. So as we've kind of broken down the EHR space, the next best step, in your buying journey is to really identify what your needs and priorities are as a clinician, and what you're looking for in an EHR. And of course, this is going to vary from clinician to clinician. So it gives you the opportunity to reflect on what's really important to you. So where I recommend to start is by thinking about your previous experience with EHRs. As mentioned, even if you've only used larger EHR systems like Epic or like Cerner in the past, I think it's really important to ask yourself, what did you really enjoy about using them? What were some key things that really made your life easy, that you'd love to see in your private practice EHR? Were there any things that you maybe really disliked about them that you want to make sure you don't have to experience again? And then lastly, a question, is there anything missing in that EHR that would make your day-to-day as a clinician really easy? Because as you're exploring these EHRs, more tailored to solo provider private practices, they might have those features available to make your life easy. So just something to think about, and really reflecting on your previous experience with EHRs. Second, after you've had the chance to think about your previous experiences, it's really important to identify, okay, what are my top priorities or top needs for an EHR? Because I'll say today, not every there isn't an EHR today that's going to have everything that you're looking for. So to really enhance the buy-in experience, When you meet with each representative, whether it's myself or another account executive at another EHR, it's really important, and if they don't ask, it's really important to share, hey, Reese, these are my, top 3-5 things that are really influencing my decision, are important to me, because then that's going to change that conversation that you're having with that individual. So that way they can show what's important to you and show you how you can really, effectively use that EHR to enhance your day-to-day. And then lastly, if you have an admin team, it's really, it's important to ask them to, what's important to your admin team? What are they looking for in an EHR? How can we make their lives easier? So it's important to, have that influence your buying decision as well. And then third is thinking about budget. Do you have a budget set aside for, when selecting EHR? Is it, do you have a strict budget that you're sticking to no matter what you see in the space, or are you willing to pay a bit more for the right fit EHR, even if it's a bit, beyond, what you have set aside? And then also too, this will also help, qualify certain EHRs out. So that way you can give some time back in your day-to-day and not have to spend, 30, 45 minutes on a demo when hey, I probably can't afford this specific EHR. And then lastly, this is, I would say more useful for if you already are currently using an EHR for your private practice and are looking to switch, is thinking about, okay, after looking, evaluating certain vendors, what is the cost of staying with my current EHR? So, while a certain EHR might be a bit more expensive than the one that you're currently using, if I decide to stay with my current EHR, am I going to be spending, longer hours, completing notes? Am I going to be, is my frustration with the support gonna, continue to rise and, take up, just add stress to my day? Are my patients gonna be more upset? So thinking about, hey, is spending this extra $50, maybe $100 a month worth, replacing those things that are making my day-to-day a bit more stressful or strenuous? So I think that's really important to think about too as you're making your decision.
Mm-hmm. Yeah, and I when I think of these types of things with any kind of tech tools, I think like, what is my hourly rate, right? Like, how much do I charge to see a patient? And if this tool saves me time that I could be doing that, it kind of puts things into perspective, because most of these EHRs we're talking about, aside from like Epic or something like that, most of them are within a price range where they're genuinely probably less than your hourly rate. So you really have to look at where the efficiencies, how much of a nuisance is something that this can actually do. And then I think that start to get a little bit less hung up on the pricing. I see sometimes people get hung up on $10, $20. Don't think of it that way. Think of it as your time.
No, yeah, I love that. I love the hourly rate piece. And I will say too, as I mentioned, I've had a lot of conversations with clinicians and, who have come into conversations with a pretty, strict budget in mind, or saying, hey, Reese, I plan to spend, only X amount of dollars. And at the end of the conversation saying, hey, I'm willing to pay this amount now, knowing that it's going to give me this much time back in my day-to-day, or going to make my patients experience this much better. So yeah, definitely something to think about. Okay, wonderful. Great. So yeah, now let's get into a big reason again why we're here today, and thinking about 5 questions to ask your account executive or your sales rep when considering a psychiatry EHR. So we'll kind of go through each of these one by one. So the first one that we think is is really important to ask each EHR is, are there any hidden fees or costs that I should be aware about after signing on? And and with the clinicians I speak with every day, this comes up a lot, and it's tough to hear, because a lot of clinicians get burnt by this, where they signed on with an EHR thinking it's a certain monthly price or yearly price, and then thinking about some features that are, are key to their day-to-day, whether it's telehealth or having e-prescribing set up, and they find out that that's going to be an X amount of dollars extra per month. Or, they have to pay an additional fee for every text reminder they send out or every message they send within the EHR. And I think it's, a bit unfortunate that this is kind of the trend in the EHR space. So when you're having that discussion with your sales rep, think about, make sure we ask this question, because there can also be fees for onboarding. There can be fees for implementation. So just something, I would make sure we ask in every conversation that we have within EHR.
Yeah, and implementation fees sometimes for particularly some of the more medical EHRs can be pretty high. Don't see that as much with the mental health and therapy ones, but it could be several $1,000s, and even just to transfer your records, whereas others will not really need much implementation at all. You can just sign up and kind of have it out of the box, or and a thing would be free to transmit patient demographics. So devil's in the details on these things.
Definitely. And to that point, and to that point too, with the technology today, with software, a lot of solutions are now pretty plug and play, where, hey, if you want to sign on, you'll get access to your account right away. They have pretty simple self-service models. So, I think hopefully we'll kind of see a move away from that implementation cost when thinking about these private practice EHRs.
And actually, a lot of them that have implementation costs also tend to not have like month to month or maybe even annual contracts. Like some of them have multi-year, like pretty airtight contracts. I speak from a negative experience where I signed on for a 3-year contract with something that was not as advertised. And, we ended up needing a lawyer and all this kinds of they can be pretty bad. And I've seen a lot of clinicians basically stuck in, it's like being in an unhappy marriage with an EHR that they're pretty miserable with. So I would caution against these multi-year type contracts unless you're really certain. And it's great to have something that is month to month, or even annual. Like the worst case is not horrible, but 3 years is pretty bad. 2 years is pretty bad if it's just not working for you.
Yeah, 3 years is pretty. Yeah, 3 years is pretty crazy. And hopefully, if it is a 3 years, you're getting a pretty good discount or or rate with signing on that for that long. So
yeah, some of them it's like how they do it, right? They're just and again, I think more medical, more group practicey type things. You get into this world. Definitely don't recommend that.
Wonderful. Awesome. So yeah, then the second question we recommend asking is, is understanding what kind of support do you offer? And as we're just referring to, what does that onboarding and implementation process look like? When I sign on, is it going to be myself setting everything, up on my own? Will I have a point person to talk to, where I can have conversations or have them walk me through the platform, ensure that I'm set up for success? What kind of how available is your support? Are they based in the States? Are they offshore? Those types of things are important to think about to ensure that you feel really comfortable and excited about moving forward with the EHR, and feel that it's going to be more than just selecting an EHR solution, but a real partner for you in helping you set up your practice and setting your practice up for success and for high growth. So we had a chat coming from Michaela. What should my expectation be with regard to support? What is standard for private practice EHRs? Yeah, that's a really good question. So your expectation, set your expectations high. As clinicians, a lot of clinicians have, reached out to Osmind in the past because they're really frustrated with the support of their current EHR system. They reach out asking a question and don't hear back in a week. And I don't think that should be the case for clinicians who have extremely busy days, who don't really have that time to wait on an answer. So set expectations pretty high going into these conversations on what you want that support to look like, whether it's one-on-one onboarding sessions or live chat or phone support. So I think that's kind of how you should be going into these conversations.
Yeah, I think we need to think of EHR support not like calling the cable company support, right? Things that are calling cable company, calling the airlines, calling that kind of stuff is calling your insurance company. These are all very negative customer support experiences. With EHRs, it's you're working with patients. You can't afford to be having this like being hanging, right? So I think my ideal support is kind of what you see with just modern businesses, which is they usually have a little bot, a little in-app thing that you can message and get answers to simple questions. There's good support guides. But if that's not doing the trick, you can very quickly escalate to an actual human, and that human can text with you, they can get on the phone, they can get on a Zoom if they need to, right? So that you can escalate based on what you need. I think that's really important because not everything does need a human. And I think that there's a time and a place for that. And so it's really worth kind of digging into this and asking others, other colleagues who use the product. They'll have plenty to say about support that they've received.
Yeah, totally agree with you there. Having that, easy access to, that human interaction if needed. Awesome. So moving on to number 3, something that might be not as thought about as often is asking the EHR, which vendors are you currently integrated with, and why did you choose them? And when we're talking about these integrations, we're thinking about, for example, like a telehealth integration. Are they going to be using a solution like Zoom, or maybe one maybe one like Doxy, which I know is very popular in the private practice space, where it might be a little bit more unreliable. So, or beyond telehealth, thinking about what payment processing tool they're using, or which e-prescribing solution they're integrated with. So these are things to think about just to help you understand. Okay, this is the cost of the EHR. Does this cost maybe line up with these vendors that they're integrated with, if they are, kind of top of the line solutions there?
Yeah, I've used EHRs in the past that have integrated telehealth, but it's not good. So I do, group work, family work. Sometimes I need more than one person on the Zoom. And a lot of the integrated ones, unless they're with something, pretty robust like Zoom, they don't do that. And so then I still need to purchase that standalone. So that's really, it's really a problem. Same with credit card processing, right? Definitely ask, what is the rate? What's the fee structure? Because using a standalone credit card processor that's not integrated is a lot of work, a lot of error prone. Much better to use one that's integrated, but you got to get into the details of that.
Yeah, definitely. And I've heard clinicians too who signed on with platforms that have these solutions, but then, as you said, they go on to purchase their own just because it doesn't work well. So something to think about there. Okay, wonderful. Moving on to number 4. I think this is a big one, especially if you are a mental health private practice. What makes you tailor to psychiatry? What specifically within the EHR is going to make my day as a mental health clinician, easier, whether it's going to be, hey, we have built-in questionnaires like the PHQ-9, like the GAD-7 that you can send directly from the EHR, and then, automatically score and graph them for you. Easy to click mental status exams within the notes, psychiatry tailored notes, or intake questionnaires that you can send out to your patients. So I think this is a great question to ask EHRs, just because when thinking about, hey, I'm going to be spending this amount of money, every month on an EHR, you might as well make it one that's, tailored to your, field of medicine versus one that's a bit more generalized. Wonderful. Great. And the number 5 is asking this EHR, what's on your roadmap? What features, or I'll jump into that, what's on your roadmap? I think this is a great question to ask too, just to understand kind of what is the vision for this EHR. What do they have, where do they think they're going to be in 2 to 3 years? How will they partner with you and help your practice grow? And I think a really great question to understand, if this is something that they've done in the past, is thinking about, what features have they built recently based on customer feedback? Is this going to be an EHR that is eager to hear your feedback about the platform and then continue to innovate and develop based on clinician feedback? Or is this one that's going to be pretty stagnant and pretty concrete in what they offer with no real ability to change? So this is going to be based on what you're looking for as a clinician, but I think something that can be important in your decision to finding that right fit EHR.
Mhm. Yeah, and I would say like during sales, that sometimes the sales rep, not Reese, not ours, but some people will promise things to customers about the roadmap that aren't realistic. It's like, oh, it's on our roadmap, but maybe a year or two from now. So it's important, it's not actually oftentimes realistic for someone to say, this is coming out in a month or this is coming out in 2 months. But what you're looking for from that sales associate is, if they don't know, they'll find out from the team. Or if they do know, they are able to say, I think this is going to come out in the first quarter of the year or the second quarter, or to be honest, we think this is a great feature, but it's not going to be in our, in our roadmap for a while because of some technical reason or whatever reason, because sometimes that's the thing we have to remember, is that something we want as a clinician, it sounds simple and sometimes it's not. And so I think it's really important to have that transparency and not have hard and fast deadlines, but have general guidelines. I think, Reese, that's sort of how you approach it. I don't know if you'd want to say anything more because you get all of these questions all the time, right?
No, exactly. And I think the word you said there is transparency. I think as a salesperson, what I value most in my role is to be really transparent with the clinicians I'm working with, and they're saying, "Hey, Reese, is this feature on the roadmap?" And I'm okay to say, "Hey, it's not," but I'll be able to list some reasons why in terms of if it is not. So I think getting that transparency from your sales rep is really important to understand, that you have that trust in them, but also that you're making the right decision. Awesome. Well, wonderful. So yeah, those are the 5 questions that we think are really valuable for you to share. And that one quick slide that was just shown there with the spreadsheet. So as a reward for registering today, attending today's event, we have a EHR buyer spreadsheet or worksheet that we will be sending your way. And in this spreadsheet, you want to give you some really easy tools, and a lot of it we discussed today, but just some things to think about, as you're exploring EHRs and understanding what your top needs and priorities are and how important they are to you in your decision. So kind of a checklist there. And then secondly, included in that spreadsheet as well is a way to kind of compare EHRs side by side to those, top 5 features that you're really looking for in an EHR, just to make your buying decision and journey that much easier. So as a follow-up, we will be sending you that shortly afterwards. I know we have about 1 minute left for Q&A. So if you have any questions, feel free to jump them in the chat.
Looks like we have one last one, which is a good place to end, which is, if you're starting a new psychiatry practice, should you get an EHR right away or wait? I can take that one. Get one right away. You want to set the foundation early. You don't want to kind of use paper charts, I think, at all, and then try to convert later. It's good to get off on the right foot. So we oftentimes will work with practices who aren't opening for maybe a couple months, right? And most EHRs, you sign on and they won't you can say like my actual go live date is going to be so many months from now. That's what I would recommend doing. And your go live date with that EHR, and when you start paying for that EHR, is when your clinic is going live, and consider it part of the launching process. I would not recommend, trying to do something kind of else, early on. And particularly because a good EHR, particularly a psychiatry tailored one, it's actually going to be like a partner. It's going to be like a sidekick, right? It's going to help you with your workflows. It's going to help you put that structure in place that you need to actually run your practice. So like, I can't imagine starting a practice without having that sidekick at my side. And if it's not a sidekick, if it's a boulder in the way, it's probably not the right EHR.
Definitely. And it's a lot easier too to get started right away versus having kind of those patients going and then having to import them into, an EHR later on.
Absolutely. Well, Reese, this was great. Thank you so much. And thanks for the questions and for joining us. And look forward to folks getting that spreadsheet. And if you want to reach out and connect with either of us, we're both on LinkedIn. And if you want to learn more about Osmind, check out the contact us page. And we hope to stay connected. Thanks so much.
Wonderful. Thank you.
Bye-bye.
Bye.